So hi, my name is Gloria Maria John. I am an overseas dentist. I've been working in India for about 4.5 to 5 years, and then I came to the UK with my family, and I'm here now. I've been practicing. And I'm a GDC registered dental therapist and hygienist, practicing in the UK for about 2 years now. And in this practice, I've been here for about 2 weeks, and going great. Started on, and I think about me, I'm passionate about patient confidence. I find dentistry very rewarding, and I feel that every patient who comes to my chair should feel at ease and should be happy when they leave the chair. So what I feel is that if you ask me, I would tell healthy gums don't bleed, and if they do, I'm sorry, your gums are crying out for help. So what we generally need to realize is that plaque accumulation usually starts between the teeth, and that's where we all have to give a lot of emphasis about. Generally what we do is we brush our teeth very well, but we tend to forget these little spaces in between the teeth, where it can be quite well managed if we adhere to proper oral hygiene techniques at home by using proper interdental brushes, water flossers to keep these spaces neat and tidy. And also we can also think about changing your brushes every 3 to 4 months, because if these bristles of the brush are flattened, you're doing more harm to your teeth than doing any good to them. I would say rushing the brushing basically. So I think some people have this kind of thought in the back of their head that if they brush too hard, they get their teeth too shiny and bright. But actually, the contrary, you're doing wrong. You're just damaging the teeth. You're just basically wearing out the teeth and doing more damage to the gums basically. So the guideline says that you have to brush only for about 2 minutes, making sure if you're using a traditional brush, you move in gentle circular motions, and whether you're using an electric toothbrush, you just make sure each tooth gets around 3 to 4 or 4 to 5 rotations. That's it. So I would say I would generally, when a patient comes in my surgery, I would generally, once they're comfortable in my chair, I would walk them through each and every instruments that I'm going to use and make sure there are no surprises in between. So before I'm going to start the treatment, I think they know what all instruments I would be using in them, and I would also ask them to raise their hand if they want me to stop, if they want it breaks. In that sense, they would have this thought of getting control over the treatment. And I think the nurses here also does a wonderful job by efficient suctioning, which helps to really ease the treatment and provide a effective and comfortable treatment for the patient as well. I would say consistency. So consistency is the key. It's generally just a matter of developing a 2 or 3 minute habit every day. Just consumes about 3 minutes of your day. Just making sure you use a proper fluoridated toothpaste, an interdental brush, and a water flossers, and making a general 6-month checkup and coming to your dentist regularly, and keeping up to these habits every day and not just 2 or 3 days before your checkup. So with kids, what we do is we generally have a little bit more longer appointments. So especially if it's their first appointment, we adhere to something called as a tell, show, do. We generally walk the children through what we're going to do. We generally introduce them to the little instruments that we have. We just let them hold the instrument so that they get to know what we're going to put inside their mouth. And we generally help them to use the suction by themselves, let them know what it feels. And then maybe if they're all right, we might do a treatment that day, or maybe we'll let them go and come for the next appointment and do whatever treatments they would like to. And at the end of the treatment, they get a sticker for which they might feel a little rewarded. I would say just to limit any sugary stuffs, especially 1 hour before bed, before your child goes to bed. It's called as the golden hour. So 1 hour before bed is the golden time where you should really refrain from any sweets, especially lollies and all those stuff which really lingers a lot of bacteria and sweets inside your mouth. And regular checkup appointments 6 months, and be consistent and regular with your appointments.